we'll go over some of the cerebellar atrial occlusion. Now, cerebellar, this is the, again, cerebellum blood supply, okay? Now, we're starting with pica, posterior inferior cerebellar artery. Now, occlusion of that artery, now it is supplying blood to cerebellum and also lateral part of medulla. Now, if there's occlusion of pica, it will affect ipsilateral, the same side of the body, hypertonicity, and hyperactive reflexes, okay? Now, medulla, if the medulla is disturbed, if there's an occlusion, then there's no blood supply to medulla. There's a syndrome called Wellenberg syndrome. That's a lateral medullary syndrome, which can result in sensory deficits affecting the trunk and torso or extremities of the opposite side of the infection. It can also result in the loss of pain and temperature. So, and can cause loss of pain and temperature. And it's on the contralateral loss, okay? So it's not on the same side. The pain and temperature will be lost on the opposite side. Dysphagia. So the medullary functions are very important. If there's any occlusion in pica, it's going to cause a lot of different symptoms. Again, vertigo, ipsilateral hypertonicity, hyperreflex, hyperactive reflex, loss of pain and temperature. Now, if the anterior, inferior cerebellar, and superior cerebellar arteries, when I merge them together, if there's occlusion of these arteries, it can result in ipsilateral ataxia. Ipsilateral means same side of the body. Ipsilateral hypotonicity and hyporeflexia, dysmetria. So, movement decomposition. Ataxic gait, again, cerebellum is involved here. Incoordination. Okay. So these are some of the different structure, again, sulcus, and every part of the brain is responsible for something. It's labeled as one, as I mentioned before. If this is a motor cortex, this is a sensory cortex, and if someone has problems, this area comes in the frontal lobe. If somebody has occlusion of MCA, it might cause contralateral hemiplegia. And let's say number 3 or 4. 4 is a Broca's aphasia here. This is a Broca's area, right? Production of that produces your speech. This is responsible for the production of speech. That's the left hemisphere. And in the Wernicke area, it should be number 14. So a lot of impaired language comprehension on 14. See, this is the Wernicke area here. So every part of the brain, you just try to see the important structures, 1, 2, 3, see versus this area, frontal lobe. This is superior part, what is responsible for Broca's area is here, Wernicke area is here, and what each section is doing. Just try to read and get familiarize yourself with the terminology. Okay, so let's talk about the homunculus. That's the that will present like a face, trunk, arms. And in the previous lecture, the Professor Lectera did explain what the homunculus is. So as I mentioned before, the superior part of the brain gets the blood supply from ACA. Okay, and after that MCA division, correct? Before superior part was getting blood from ACA, and then the lateral part, all the lateral part was getting from MCA. So if there is an occlusion of ACA, your lower extremities will be affected. So this is a part of brain right here will be, see the arteries are shooting up and they provide blood on the superior part. So this area is covered by ACA. And ACA will, if there is the occlusion of ACA artery, what will happen? That there will be deficits in lower extremity, okay, lower extremity. And if there is a deficit of MCA artery, there will be more deficits on the upper extremity, because trunk, neck, head, shoulder, face, all the muscles, the motor area is covered by MCA. Now, with the MCA, we have seen that sometimes person presents with the whole left side stroke, correct? Hemiplegia or hemiparesis. So what happens, as we mentioned before, the ischemic penumbra, right? There's the area that is going to die, but is still viable and can be restored. It may cause some of the weakness in the leg. If somebody has a right MCA, weakness in the left, but if it's restored, the person might not be hemiplegia, but the leg might be a little bit weaker than the other leg, but it might not be paralyzed completely. So trunk above, trunk above to your head, to your face, is covered by MCA artery, and your leg, your hips below, is covered by ACA artery. And if this area of the brain is stimulated by, uh, we stimulate the area using electric stimulation, what can happen? If you stimulate this area, your leg will move. Okay? If they stimulate the area in this region, the motor part of the ear, this is the motor part, premotor cortex, the trunk above all the muscles. If you want to move the face, you stimulate this area. So let me go above here to show you again. Where was the homunculus? Okay, so homunculus is like this. Homunculus will start right here, the face. Okay, we'll start here, face, and then move here to trunk, your arms, and your legs will be right here. And as you know, this stripe is getting blood from ACA, right? This stripe is getting blood from ACA, and from here, it's all MCA. So homunculus will start here. So this is sensory, this is motor. If there's the occlusion of ACA artery, your legs, motor impairment, and sensory impairments of the leg will happen. If there's a AMC occlusion, your trunk above all any muscle will be affected and less on the legs. Okay, so that's the concept here. So ACA provides superior part of the brain. There's a homunculus has legs over there, and where MCA provides the blood of the lateral side of the head, there's our trunk, your head, your trunk, shoulder, arm, your face muscles. So MCA is providing blood to your face, to your trunk, and ACA is providing blood to your hips down.